The goal of exercise protocol 5 is accuracy of swallowing. Use water to moisten the mouth. Place tool number 1 on the palate behind the front teeth. Place tongue tip in the hole opening. Bite teeth on the handle, swallow with lips against the football shape. Tool number 2 is designed to strengthen the tongue tip elevation movement to the palate. Tool number 2 is also used to retrain tongue thrusters to reposition the tongue tip inside the mouth on the palate behind the front teeth. Note the hole opening in tool number 2. This helps the patient feel where the tongue tip should be placed, guiding the patient to position the tongue tip on the palate behind the front teeth when speaking and swallowing. Muscles exercised include the genioglossus and intrinsic muscles of the tongue. The goal of exercise protocol 1 is to feel the tongue tip inserted into the hole opening of tool number 2. Place tool number 2 in the palate. Position the tongue tip into the hole opening. This allows the patient to get a tactile feel of contact against the hole opening. The goal of exercise protocol 2 is tongue tip elevation strengthening. Place tool number 2 on the palate behind the front teeth. Press the tip of the tongue into the hole opening. Apply pressure as long as possible. Record number of seconds that pressure can be maintained. The goal of exercise protocol 3 is to increase range and ease of movement of tongue tip elevation to a front palatal position. Place tool number 2 on the palate behind the front teeth. Elevate and lower the tongue tip in the hole opening. Repeat as many times as possible. Record the number of tongue tip elevations into the hole opening until fatigue. The goal of exercise protocol 4 is precision of movement. Place tool number 2 on the palate behind the front teeth. Elevate the tongue tip in the hole opening and repeat the following sounds.
Ta, ta, eight, oot, eat.
Repeat sounds. Pa-ta, pa-ta. Record the number of pa-ta sounds articulated in 10 seconds. The goal of exercise protocol 5 is accuracy of swallowing. Use water to moisten the mouth. Place tool number 2 on the palate behind the front teeth. Elevate the tongue tip into the hole opening. Bite teeth on the handle. Swallow. Tool number 3 is designed to strengthen the tongue tip and retrain tongue thrusters to use corrected patterns with repetition to achieve automatic execution of proper tongue tip positioning. Patients are encouraged to use both tool number 2 and 3 in tandem, using the exercise protocols as a tongue tip exercise. Tool number 3 features a concave section that pushes up to form a ridge, which is textured. Exercising the tongue tip against this ridge both strengthens the tongue tip and reminds the patient not to thrust their tongue by restraining forward tongue movement. Muscles exercised include genioglossus and intrinsic muscles of the tongue. The goal of exercise protocol 1 is to feel the tongue tip against the ridge of tool number 3 that shields the tongue from thrusting. The patient will press the tip of the tongue against the concave section of the ridge. Close the lips, and the patient should get the tactile sensation of an intraoral position while restraining the tongue from pushing or thrusting out of the mouth. The goal of exercise protocol 2 is strengthening. Place tool number 3 on the palate behind the front teeth. Elevate the tongue tip against the concave section of the ridge. Maintain pressure against the ridge until fatigue. Record patient's ability to apply tongue tip pressure until fatigue in number of seconds. The goal of exercise protocol 3 is range and ease of motion. Place tool number 3 on the palate behind the front teeth. Elevate tongue tip against the concave section of the ridge. Lower the tongue tip from the concave section of the ridge. Continue to elevate and lower the tongue tip until the patient experiences fatigue. Record number of elevations within a 10-second period. The goal of exercise protocol 4 is precision of movement. Place tool number 3 on the palate behind the front teeth. Repeat the following sounds.
Ta, ta, eight, oot, eat.
Repeat the combination of sounds. Pa-ta, pa-ta. Record the number of pa-ta Sounds articulated in 10 seconds. The goal of Protocol 5 is accuracy of swallowing. Use water to moisten the mouth. Place tool number 3 on the palate behind the front teeth. Bite teeth on the handle, close lips, and swallow. Tool number 4 is designed to strengthen the back elevation of the tongue for speech and swallowing. Weak tongue elevation movement that cannot contact the back of the palate during swallowing may lead to aspiration of food into the lungs and possible pneumonia. Tool number 4 has an elevated ridge with a textured surface. The combination of these features help the tongue feel the proper placement in the back of the palate. Muscles exercised include genioglossus, styloglossus, palatoglossus, hyoglossus, and intrinsic muscles of the tongue. The goal of exercise protocol 1 is to feel the ridge of tool number 4 against the back of the tongue. Place the ridge of tool number 4 on the back of the tongue to give the patient a tactile sensation of where the tongue should elevate, to the back of the palate. The goal of exercise protocol 2 is strengthening. Place tool number 4 on the palate behind the front teeth. Elevate the back of the tongue against tool number 4. Maintain elevation as long as possible. Record time of elevation in number of seconds. The goal of exercise protocol 3 is to increase range and ease of motion for the back of the tongue to extend to the back of the hard palate. Place tool number 4 on the palate behind the front teeth. Elevate and lower the back of the tongue against the ridge of tool number 4. Repeat as many times as possible. Record number of elevations until fatigue. The goal of exercise protocol 4 is precision of movement. Place tool number 4 on the palate behind the front teeth. Make sure that the back of the tongue makes contact with the ridge as the patient repeats the following sounds.
Ka, ka, ache, ook, ache.
Repeat the combination of sounds. Pa, ta, ka, pataka. Record the number of combinations articulated in 10 seconds. The goal of exercise protocol 5 is accuracy of swallowing. Use water to moisten the mouth. Place tool number 4 on the palate behind the front teeth. Bite teeth on the handle, close lips, and swallow. For the complete set of exercise protocols using the Ora-Light Oral Motor Exercise System, refer to the instruction manual included with your Ora-Light package. Patients can achieve positive results in a shorter time period by utilizing the Ora-Light Motor Exercise System in both a clinical therapy environment and with repetitive oral motor exercise in a patient's home. The additional repetitions of correct muscle movement patterns will expedite improvements in the patient's speech and swallowing. The goal of the Ora-Light Oral Motor Exercise System is to provide as much repetition of the corrected pattern as possible and to achieve automatic execution of the skilled task. For additional information on the Ora-Light system, go online to capitex.com or contact your local sales representative.